Body dysmorphic disorder is a mental health condition related to body image in which someone has a preoccupation with a defect in their appearance. The defect is imagined or an excessive concern with a small anomaly.
The source of BDD can be quite complex. It usually emerges in adolescence when there are obvious puberty changes physiologically and with hormones. They have a low self-esteem, and that can be related to lots of things. Sometimes it's linked to abuse in childhood. Sometimes from a sort of psychodynamic perspective, often one's inadequacies are projected onto this perceived deformity as a way to allay the anxiety.
The signs of BDD include a preoccupation with physical appearance and extreme self-consciousness, excessive grooming, reluctance to appear in pictures, and even avoidance of social situations.
Often people with BDD don't actually present for treatment because they're so ashamed, because it causes them such distress. Sometimes cosmetic surgery is an attempt to obviously bring about relief, but doesn't actually result in that.
Another sign of body dysmorphic disorder is an excessive interest or addiction to cosmetic procedures, but without ever being satisfied with the results.
Plastic surgeons who do cosmetic surgery see people day in, day out who are either unhappy with the way they're aging or unhappy with a body feature, and we go ahead and offer surgery where appropriate. The difference here is that this is an all-consuming problem for the patient where it appears very, very slight or non-existent to the surgeon. So if you suspect BDD, somebody might come in, for instance, with a very beautiful nose and tell you that the nose is ruining their face, it's far too big, they can't cope with it at all, and they might even camouflage it by wearing a little attachment to their glasses or a scarf or something like that. That would make one wonder, if there isn't a bigger problem here.
Surgeons tread very carefully if they notice a patient presenting with symptoms of BDD. The patient's mental and physical well-being should be the surgeon's priority.
If you suspect somebody may have BDD, the most appropriate course of action would be to refer them to a psychologist or someone who's trained to deal with it. Operating on them is a big mistake. It's not going to make them happy, and in fact would just feed into their neurosis that there is in fact something wrong with that particular organ or part of their body. To make sure that our surgery is appropriate, you meet with the person for consultations, usually more than 1, 2 or 3, or as many as it takes, to try and get an understanding of what's motivating that person to have the surgery, and to make sure that you can identify the problem the same as them. If the surgeon, who's the professional, can't see the problem, then there's no grounds for operating. If somebody who we deem is not an appropriate candidate for whatever reason for surgery, then we just don't go ahead. We're in the fortunate position where we don't have to operate on everybody who requests it. And so if we feel that it's inappropriate for whatever reason, we just say no and we refer appropriately.
The most common age for diagnosis is 17, although BDD usually begins in late childhood or early adolescence. The first step is to identify the problem.
If anyone's watching who might know somebody who experiences symptoms of body dysmorphia disorder, it's very important that you do something about this, because you don't want the person to obviously suffer.
Consult your family healthcare practitioner if you suspect that you, a family member or a friend has BDD. Seek help and learn to love the skin you're in.